so another form of low back pain that we see quite frequently is actually facet joint discomfort or facet joint pain. Essentially what that is, so we have these joints that run all along our spine, and they're kind of like the hinges of our spine. They allow for certain motions and guide the motion as we go through it. So flexion, extension, rotation, those sort of things are guided through those facet joints and allowed through those facet joints. If one of those joints does become inflamed, then we can have some pain with certain motions such as extending and rotating. That's typically the pain pattern that we see, just because if we take an inflamed joint, then we go to jam it, right, by extending and rotating, it's not gonna feel very good. So that's typically what we see when someone comes in with back pain and they have pain when they're extending, rotating, and it's right in that like low back at full extension. We're thinking, among other things, but mostly like kind of the top of our list is going to be facet joint pain. So we're going to do some orthopedic exams and see exactly if that's what's going on, but most of the time that is the case. And what we want to do in those situations is kind of different than the discogenic low back pain, where we wanted to avoid forward flexion because that disc material is getting pushed back. This one, a little bit of forward flexion is going to be more beneficial than if we were to just load the spine in extension. We still want to make sure that we're bracing the core properly, keeping the glutes, QL, all those things engaged as we go into forward flexion, but those sort of movements and those sort of rehab exercises would be beneficial for something like this.